Good morning, sir. Namaste, Dr. Vaishali. I'm very happy to see all the galaxy of physicians who are joining in this movement to sort of reclaim what we had lost in the last maybe 50 years of medicine. We have compartmentalized medicine to such an extent that yesterday I had a couple of patients who came with pain, and one of them had been operated by 3 different surgeons for the wrist, the elbow, and the shoulder. And no, he said, the wrist surgeon said, I can only operate the wrist, and the elbow surgeon only operated the elbow, and the shoulders only operated the shoulder. And he had the pain. So that is the situation now. And, we have to reclaim, particularly in the context of the traditional Indian knowledge that we sort of, have given up, it looks like. What I will try and do is I will share my presentation. Are you able to see actually, sir, my presentation?
Yes.
Okay. So what I'm trying to say in this next maybe 25 minutes is that what we really call as medicine, actually we all do some kind of integrative medicine, whether we like to call it like
Dr.
that.
Shivram, your presentation is not seen. I'm sorry to interrupt you.
Oh, is it?
Yeah, you'll have to start your presentation.
No, I shared it. What is happening? I don't know.
You can unshare it and restart it, maybe.
Okay.
You can stop sharing and restart it. I don't know. Amol, can you just guide?
So the problem is, I think it is a PowerPoint show. And if I open it, I am not able to see the... I think I'd also sent a copy.
Yes, I'll tell them to play.
Yeah.
Amol, can you play it at the back end so that sir can start his present?
No, ma'am, we don't have right now PPT.
Okay,
I don't have, is it?
Yeah.
I will mail you. But you can try.
So just go to the share screen. No? Share screen, there is the bottom.
Yeah, share screen. What's happening?
Yeah, there is a pop-up. There is a pop-up. You just select screen as the option.
Yeah, screen. I'm only able to see this.
Just select this. Yeah. Right now it's sharing. It is sharing now.
Yes, sir. Now you are sharing. So open the PPT here.
Now you are able to see.
Yes, that's right.
Okay, all right. So thank you, madam. So what I will try to do in the next 20-25 minutes is to show how we all really practice integrative medicine, whether we know it or we really call it that way. This is a recent edition of the newsletter that we publish quarterly called as the Samatvam. Very interesting article by a neurologist from Italy called as Antonio Ishvara Morandi. The Ishvara, he has added it after he came into touch with Indian traditional knowledge. So he's a neurologist who has a dual degree in neurology as well as he has done an Ayurveda degree. And he told me that he practices around 30% Ayurveda. And he said this is because patients ask for it. The remaining 70% patients who are not interested, he practices regular neurology. And he said before COVID, it was 5 to 10% of his patients who wanted this kind of interventions, and now it is 30 to 40%. So he pointed out this from the Sushruta Samhita, where Sushruta has actually written that to treat the patient, knowledge of one system of medicine or knowledge is not enough, and the healer has to be aware of multiple healing traditions. Way back in the Sushruta Samhita. And this is from the Rig Veda, which says that knowledge should be unhindered, should come from everywhere, and the person should not be restrict himself to just, what we call as Kupa Manduka, or thinking I am in my own well, and that is the world. So this is an article that we published some time back about what we mean by integrative medicine, because this term, for example, the National Council for CAM, what used to be called Complementary and Alternative Medicine in the US, is now called the National Council for Integrative Medicine. So they are now calling integrative medicine, some refer to as functional medicine. Whatever it is basically looking at the person as a whole. And to eliminate a lot of confusion about terminology, we had published this article, and this talks about a perspective from Not only psychiatry, from low back pain. The example of low back pain is very instructive because even the guidelines for low back pain by all the leading authorities of the world, yoga is a first line therapy before you try other options. And unfortunately, this is not well known in India itself. It is America, the American guidelines, low back pain is one of the, yoga is one of the first line therapies. So when we say what is integrative and what is not, for example, your endocrinologist I've been hearing talking about diabetes.
Can you mute Amol? Somebody is speaking on phone. Can you mute the background?
So the diet or the exercise is the first intervention, as many of your colleagues have been pointing out. Yes, of course, we use medicine for most people who need them. Similarly, in depression, we actually tell patients that psychotherapy is probably the first option when they come to us, simply because it enables you to keep the depression away once you recover, whereas medicine cannot do that. Medicine, as long as you take it, of course, it will work, but the moment you stop it, its effect is gone. Whereas psychotherapy and lifestyle change, the effects are lifelong. That is the real difference in these kind of interventions. And I was saying about low back pain, even the guidelines say yoga or physiotherapy is the first option, plus or minus medication, the last option being surgery. So all these things are really integrative medicine. So what are the components? The three important components are a local or a traditional health approach. In India, we are lucky to have Ayurveda and yoga, which is part of our heritage of Bharat. And we should really be proud of this, whether I need not be an Ayurvedic physician, as I only have to be an Indian to be proud of this and what it has contributed to the world. Of course, we should also use modern biomedical treatments, which has really, increased and made us much more aware of the inner workings of the body. It's a very important advance in the last 200 years. So I do not mean that we should ignore the treatments which are there in the modern medicine, but then we should try to combine these two, and more importantly, look at this using modern research methodology. So this is truly what we call as integrative medicine. And as we all know, there is a lot of work on diabetes and depression, the connection. So there is a very, very strong interlinking between positive mental health and positive physical health. And if when we don't have either of these, then we either go into mental illness or physical illness. And the difference is becoming a very thin line now, who is mentally ill and who is physically ill. For example, the recent National Mental Health Survey, which was conducted by NIMHANS across the country, shows that 1 in 4 in India have some kind of mental illness. It may be minor, it may be major, but it's a huge proportion of the population. So if you take our population is 130 crores, it is nearly 30 to 35 crore people who have some problem or the other. And we are seeing it increasingly in our own medical profession. For example, NIMHANS admits 40 residents a year for MD. And every year we find at least 2 or 3 of them themselves have either anxiety or depression or something or the other. And once they join, they come and talk to us regarding treatment for themselves. So this is not unique. This, I'm sure, will be there in most postgraduate programs around the country. Unfortunately, the problem is the treatment gap, which is the proportion of people not treated, is a huge 80% or thereby. This is so difficult because of the stigma, because of lack of access to care, because of not sure what to do, and COVID has exacerbated some of these problems, but also has shown us some solutions. For example, telepsychiatry is now a huge thing. The Telemanas program of the government has started picking up a lot of pace now. But in all this, we are forgetting the part that the first job of a doctor is to prevent person having a mental illness. What are the treatments we have for mental health? We have excellent medications actually, but particularly for depression, psychosis, anxiety. But of course, they do have some adverse effects. And how long to take is the first question that the patient and the relative ask. And most of the time we have no clear answer for that, because we need to prevent the relapse. And we know that relapse can happen anytime in the next few years. Psychotherapeutic approaches are also very effective, but it's very difficult to find trained psychotherapists in India. And again, the duration and cost is a very significant factor. There are some newer treatments like neurostimulation, repetitive transcranial magnetic stimulation, transcranial direct current stimulation, so many things, but they're all still in the preliminary stage. And again, here we miss the whole thing of positive mental health or well-being, which is the base on which the whole mental health stands. So when you ask people, this is from a survey where people were asked, what do you mean by positive mental health? And most people said these terms: happiness, well-being, feeling satisfied, feeling positive, finding meaning in life, and leading to achievement of full personal potential. So these are all big words, but why it is important, as I showed you, there is a very strong connection between physical and mental health. So this is all nice to say, but how do we really go on to achieve this positive mental health is the question that we have to answer. And here I would like to bring a very important concept of what this person, Csikszentmihalyi, who is a very famous psychologist who escaped from Hungary during the Second World War and became a very famous psychologist in the US later, has written a book called Flow. It's a wonderful book. I'm sure many of you would have read it. I'll recommend a lot of my patients also to read this book, because he really described what are called as peak experiences when you are in flow. For example, I'm a sportsman, so I'm very big fan of Federer and Tendulkar. So I take examples from there. So when Tendulkar is playing cricket or Federer is playing tennis, we say that he is in the zone or he is in the flow. Now, what does that mean? That means that your capability and a challenge is evenly matched. You are playing to the best of your potential, and yet it's not boring. You are challenging yourself. Now that is the state of flow. You can take it from Lata Mangeshkar. When she is singing, she is so involved that she forgets herself. We were lucky to meet, myself and Dr. Gangadhar in the photo, we were lucky to meet one of the examples of Samatvam, what we call Samatvam, Dalai Lama, a few years back in his monastery in Belakupe. And he is a real example of a person who is Sthita Prajna. When he talks to you, he talks about your issues. He sees 200 people a day, and each of them he is able to talk about their issues, forgetting himself. Now that's a mark of a great man, and possibly that's why he has the admiration of millions of people. We also have examples from yoga, Iyengar ji, from mathematics, Shakuntala Devi, the genius of India, and Abdul Kalam ji, who was the president, who rose from very difficult circumstances to actually reach the peak of their potential. As you all know, Iyengar ji was a very sick, asthmatic kid, and he turned to yoga as a solution for his health problem, but then he revolutionized the field because he excelled in it. How did these people do it? By training their body and the brain. And luckily for all of us, the body and the brain are remarkable students. How do we train the brain? Now, for this, we have to look at what is the correct understanding of brain functioning. All of you may remember that when we were medical students, we were taught something like the brain is a very static organ. So there is some damage to some part of the brain. No, that's it. And, you can't really do much. But now we know that's not true. The brain has an incredible ability to shift functions from one part of the brain to other if the one part of the brain is not working, and also can change itself structurally to a limited extent. And we no longer really talk about specific brain Broca's areas. We now talk about circuits and networks, because nothing is in isolation. Everything is connected to a circuit. So there is a circuit for happiness, there is a circuit for sadness, there is a circuit for epilepsy, there is a circuit for depression. So these are circuits. And one area, of course, changes the circuit in some way, but the brain can always change the circuit. And this essentially is the current difference between a brain and a computer. As of now, whatever artificial intelligence we have, the brain is much superior to any computer, because it can recognize problems in itself and change the circuit, which as of now the computers cannot do. Maybe in 50 years they will be able to do it, but as of now they really can't do that. And this idea of what we call neuroplasticity comes from a pioneer called Donald Holding Hebb, who is called as the father of neural networks. And in neurology, this dictum that they follow, that neurons that fire together, wire together, and neurons that are out of sync lose their link. That is the full, what is called Hebb's law. What it means is that if we train a particular circuit to work together, that circuit becomes stronger and stronger and stronger. For example, some people train themselves in memory and they can memorize 200 names from top to bottom. You tell the 51st name, they will tell you. How do they do that? They train this particular circuit very well. So we can all do that. Some are easy to train, some are difficult. For example, the circuits that underlie implicit memory, cycling, swimming, once you train them, they remain trained for life. I have not swum for 20 years. You give me a swimming pool tomorrow, I can swim. I never forget it. That is because these are essential survival skills. Whereas semantic memory, names of people, dates, we have to push ourselves repeatedly, but there are people who can still do remarkable things with that. So this law is the basis of our ability to rewire our brain. So we can teach ourselves to be constantly happy. We can also teach ourselves to be constantly sad. What we do is really our choice. How do we do it? Really, you go to the, practice makes perfect. For example, the pilots who run our aeroplanes, are really said to be trained if they have completed 10,000 hours in a specific aeroplane. Then they are said to be masters of that aeroplane, and they can be woken up at 12 o'clock in the night and they will fly that aeroplane. So practice is needed. We have to do this more and more if we have to train ourselves. And this excellent book by Daniel Kahneman called as Thinking Fast and Slow talks about two systems in the human body. Dr. Sanjay Phadke was one of the people who, made me read some of these books. And here he talks about two systems of our brain. One is a reflex system, which is system one, that somebody is trying to hit me, I hit back or I escape. System two is the rational, logical part of our brain. Unfortunately, most of the times we use system one. Somebody shouts at me, I immediately get angry, shout at him or hit him. Whereas the logical brain says, okay, what is the point of hitting this person? Or is it going to gain you something? Should I do that? And this part we need to use more, especially in decision making. Which are the ways that have been shown to improve this process of neurogenesis and training the brain? Yoga is one of those. When I say yoga, it always includes meditation. There is nothing called yoga without meditation. Some other ways, intermittent fasting, having really novel experiences, learning a new skill. So if I am 50, 60, 70 and I want to learn the guitar, it's a very good thing. It improves my chance of neuroplasticity. And involved reading. Basically, these are all interventions or practices where you forget yourself. You do something that enables the body to relax by not focusing on everyday problems. Fasting is also such a thing because it gives the mind or the brain time to relax without looking at digestion. That's the whole idea of intermittent fasting, so it can get on with other work. So I'm going to spend the next maybe 10 minutes giving an example of yoga as how to integrate. This is what we have done at NIMHANS. And when we talk of yoga nowadays, we tend to forget the other 6 elements of Ashtanga yoga. We only talk of asana and pranayama. Actually, in many ways, the others are as important, if not more important. Yama, niyama, the rules of living. Pratyahara, the bridge between the Bahiranga yoga and the Antaranga yoga, which is sort of withdrawal from the senses, and dharana, dhyana, and samadhi, which are the meditative aspects of yoga. Again, I think this is something that most of you will know. This audience need not be told this, but I just want to emphasize that when we talk of yoga, most of the ancient yoga texts actually talk about the brain and the mind, not really the body. So yoga is not really just a physical exercise, unlike many people in the West who think that it is. And it comes from the Shad Darshanas, or the 6 systems of Indian traditional philosophy, where yoga, Patanjali is called as the father of this, system of philosophy. And this is something that Nimans has incorporated into its emblem. This comes from the Bhagavad Gita, where Krishna says that, samatvam yoga uchyate. Yoga is nothing but maintenance of equilibrium, no matter what the condition. And Rudyard Kipling, in his famous poem If, has actually said the same thing, that if you can keep your cool when you meet, you are victorious, you are defeated. If you can maintain the same thing, that is what really makes a man. And this is a slide many of you would have seen. I put it in all my presentations just to emphasize that how you do something is as important as what you do. The posture here looks very similar, whereas the effects tend to be exactly the opposite. Iyengar ji, taking the help of a prop to do the asana, and the other person has obviously had too much to drink. So what are the effects of yoga? If you look at purely physical, yes, it does increase flexibility, coordination, and strength. But then if you really practice yoga the way it is meant to be with mindfulness, then you get the mental effects, what we call chitta vritti nirodha, ability to control the oscillations of the mind. And you are able to be in a sthita prajna state, that you maintain your equilibrium no matter what the external situation. Now, what is the evidence that yoga changes the brain? There is quite a lot of literature, not necessarily from India, a lot of it from abroad, looking at deterioration of brain. As we all know, as we age, the brain gray matter becomes less. But people who practice yoga and meditation over the long term lose less gray matter with age. That is something that has been very well demonstrated now. And we did a small study in elderly people living in old age homes in Bangalore, where we were able to show that 6 months of yoga without any other change in their lifestyle improved their memory very significant. These are all people above the age of 60, some of them above 70. And this is a meta-analysis, not from Nimans, published by Cabral and colleagues, which shows that across mental disorders, yoga has a very powerful effect in reducing symptoms. One of the studies done at Nimans by Dr. Gangadhar and Dr. Janki Ramaiah, the first randomized controlled trial of yoga as a sole therapy for depression, showed that yoga was as effective as imipramine, which is a common antidepressant, although ECT, of course, was superior in major depressive disorder. This is the first RCT of yoga as a sole therapy anywhere in the world. And we have been able to do quite a lot of work on schizophrenia, which is considered as a very difficult disorder for us psychiatrists, showing that even there, yoga can produce a lot of effects on what we call as the negative symptoms of schizophrenia, which are very, very difficult to treat. And as usual, the guidelines from the UK have incorporated yoga already. I don't think the Indian guidelines have still done this, but based on studies from Nimans, the NICE guidelines in the UK added yoga as a complementary intervention for schizophrenia in 2014. So we have been doing yoga research for a very long time, from the 1970s, but actual clinical work started in 2007, where we started the Advanced Center for Yoga in collaboration with the MDNAY New Delhi. Looking at this work, Nimans added yoga as a part of the institute itself. The first 5 years were a project mode. From 2014 to 2019, it was called the Nimans Integrated Center for Yoga. And in 2019, we have added Ayurveda and made it a full department. We now call it as the Department of Integrative Medicine, which I currently head. So what do we do here? We provide integrated clinical services, including outpatient and inpatient for both neurological and psychiatric disorders. We provide training in mental health and neurosciences for health professionals from all backgrounds. We run 2 certificate courses a year, a 1-month course and a 6-month course. 6-month course is for all doctors. Any of you or your students can join that. We are going to start the next one in July. In fact, many physicians have actually completed the course last year. We also do hypothesis-driven research with modern methodology in integrative medicine. And we have started 5 courses in the last 3 years after starting the department. The latest course and the flagship course of the department is the MD Psychiatry within Ayurveda, what is called as Manas Rog. We also have postdoctoral fellowships. We have MSc Yoga Therapy, and we also have the PhD. Our aim ultimately, Dr. Gangadhar, Dr. Fadke, and Dr. Marwale have been guiding us in this respect. We want to really have an integrated MD in psychiatry, which includes yoga, Ayurveda, along with modern psychiatry. We see around 1,500 to 1,800 patients a month in the yoga center, and we publish this newsletter, and we have published several articles in national and international journals. What we have really been doing is develop what we call as evidence-based, specific, but not patented modules of yoga for different disorders, because there is so much variety of yoga. What is to be taught in what disorder is something very important. We have been successful in doing it for most of the psychiatric and neurological disorders. We are currently working on epilepsy and low back ache. We have made the module, consulted with the experts, traditional experts, tested the module for feasibility, and most of the cases we have also done randomized controlled trials using this module. So this is the process that we have been doing, and this is just a snapshot of the work that we have done. We have already got more than 17 crores funding for the department in terms of research funds. We have published now, I think the number is close to 100. This is an old slide. Articles in peer-reviewed journals. And we also published a book on Amazon in 2020 through the Indian Psychiatric Society called The Science and Art of Yoga and Mental and Neurological Healthcare, which is available on Amazon even now. And very interestingly, for each disorder that we have looked at symptom improvement, we have also focused on finding a biological correlate. What is the mechanism of action? Because science demands that you should not only say that something works, but you have to demonstrate how it works. So for example, in depression, there is a clear decrease in serum cortisol, increase in plasma brain-derived neurotropic factor after yoga. Similarly, in schizophrenia, there is increase in oxytocin, the bonding hormone, mirror neuron activity, and improvement in connectivity of brain networks. In the elderly, we were able to show a small increase in the size of the hippocampus, which is a remarkable finding. That means that all of us can improve our brains no matter what our age is. Some of the other disorders, we are still working on that. And I would come to the last part of my presentation to give you a glimpse of the neuroscience of yoga. For example, take the Om chanting, which is a very, very simple technique. We were able to show Dr. Kalyani, who is Dr. Gangadhar's daughter, did this as a study in MBBS when she was doing her MBBS. A simple Om chanting is able to change blood flow to the limbic part of the brain and calm the limbic part of the brain. There is an actual deactivation which happens during Om chanting. It also happens similarly during Brahmari. So they are very similar in their effects. This is what I was talking about in the elderly, that we were actually able to demonstrate a small change or the increase in the size of the hippocampal gray matter within 6 months of doing yoga. This is a study in schizophrenia where we were able to show an increase in coherence between different brain regions in patients before and after yoga. If you look at the color change in the MRI scan, you can see what was before yoga and what is after yoga. This is something we call as the default mode network, which is what our brain does when we are not really doing anything in specific. When we are relaxing, the brain goes into a default mode, and that coherence is reduced in people with schizophrenia. Yoga was able to improve that. So to summarize and conclude, I would say that integration of local traditional approaches, in India's case, it may be Ayurveda and yoga, with modern healthcare is really the need of the hour, and COVID was one of the things which has demonstrated the need for this. And we very well know now that physical and mental health are deeply interlinked, and good mental health is really a matter of training and strengthening of selected brain networks. It's very lucky for us that the brain and body are excellent trainees, and we have a ready-made method of training yoga. In fact, Mihai Csikszentmihalyi, the person who wrote that book, Flow, in that he has said that whatever the Western methods of practice, nothing has ever come close to yoga in terms of training the brain. He has actually put that word in the book. And so integrating yoga into healthcare is an ideal first step. Ayurveda is a little more complicated. There are interactions because it's only a system of medicine, but we don't really need to know Ayurvedic medication for our sake. What we need to know is the lifestyle, diet, ahara vihara as they call it, what to eat, how much to eat, when to eat, in different seasons, how to take care of our body. there is an excellent store of knowledge in Ayurveda. That's all we need to know. I don't recommend mixopathy. I don't want an Ayurveda person writing allopathy medicine or an allopathy person writing Ayurveda medicine, but we need to know about each other's system, particularly the basis of health, which in Ayurveda is very extremely detailed, given for each person depending on his or her prakriti. What is the thing that they should eat, what they should not eat, when they should eat, very well given in Ayurveda. That is what we really need to learn. Of course, I should acknowledge, collaborators from the Ayush Ministry, the Art of Living, where we did some of our studies, SVasa Yoga University, CBM Pune, headed by Dr. Sanjay Phadke. Dr. Vaishali is also part of it. We have been doing a lot of work recently. And of course, Professor D. Nagaraja and Gangadhar, who are our gurus at NIMANS, and the current department, Dr. Kishore, Hemant, Paratholla, who are running the department successfully now. All the work that I have shown here is not really my work, it's the team work. And this is the team that is currently running the Department of Integrative Medicine. I hope this was useful. Thank you very much.
So it was a very insightful talk, and I think that I'll just share what we have just recently analyzed in our diabetic patients. Nearly 85% of patients were practicing other modes of therapy along with the medications that they were receiving. And all of these patients have been following me very ritually. So it's not that they are unhappy with modern medicine, but they are following practices beyond modern medicine in the form of other Ayurvedic therapies or the yoga practices, the meditation. So I think every field for that matter is more of integration rather, and patients are keen on having integration of their own therapies for their own health. So that's what I think you highlighted.
They told you because you're open to this, otherwise they will hide it.
Yes, that's right. Over to you, Dr. Marwais. I think there's a question in the chat box.
Oh, is it?
Yes, there is a question.
Okay.
It's by Dr. Umakant Shetkar. Any studies on meditation practice and improvement of cognitive function, especially memory and reason?
Thank you for this question, Dr. Umakant. There is a lot of evidence. You really want to look at the evidence of meditation and memory. There is fantastic evidence. Again, I'm sorry to say a lot of the evidence is from outside of India. In fact, the Dalai Lama, when he met me and Dr. Gangadhar, said, I have given my Nobel Prize money to institutes in America to do work on meditation. What are you people doing? It is then that we really got serious about, doing work on meditation. And our own study, which we did in elderly people with memory problems, showed us that, it was a very nice study because we went to the old age home. There were around 130 people there. So 10 people, could not attend. So the 120 people we divided into 60 people who would do yoga. The other 60 people did not do yoga. Everything else was similar. They lived in the same place. They ate the same food. They had the same other exercise and other things. But in 6 months, the people who were in the yoga arm, really their memory got better. Their sleep got better. And as I showed you in this slide, their brains had a small increase in the size of the hippocampus. So there is no doubt at all now that long-term practice of yoga and meditation can actually improve memory and brain function. That's not in doubt. The only question is, what is the specific yoga and how motivated the people are to follow that practice? Because just like our medicines, if you do yoga once a week, like most of the American studies do, not likely to really help. American yoga is weekend yoga. They go for one session on Saturday and Sunday, and then they forget about it for the rest of the week. That's not really, yoga. You have to at least follow the lifestyle and the diet practices for the rest of the week as well. You might only do asanas once a week, perfectly okay. But focus on your breathing, being mindful. So we have written a very interesting article about the difference between yoga and exercise. Because if you do yoga very mechanically, it is exercise. And if you do exercise very mindfully, it becomes yoga. Now, when we are running on the treadmill, we just focus on running. We are not looking at how I am breathing, what is happening to my body, where is my thought. If you do that, actually, it becomes yoga. Even your treadmill can become yoga if you are very mindful and focus on breathing. So that is the real difference. And indeed, It can produce a lot of changes in cognition, sir. I think, sir, should I take this question as well, Dr. Marwale? The second question somebody has put, Kanti, I think.
Yeah, I would like to know, how does intermittent fasting helps with brain training?
Yeah, I expected this question. Okay. Yeah, this is a very interesting area because when you look at the Ayurveda text, actually they say Anna Kalam Dve, which means that we should eat twice a day. And they have actually gone on to explain that if you eat a lot of these foreign diets, Dr. Pranjali was talking about some diets that, you eat multiple times a day, you eat 8 times a day and eat small. Now, it is a big problem for the brain because it's doing nothing but digestion. As you know, digestion is a very intense process. And if you eat multiple times a day, not only that the insulin has to keep responding to each of these times, the brain has to keep coordinating the digestion. And as you all know now, what we call as the gut microbiome is our second brain. And the brain is so busy looking at digestion that it has no time to repair itself. That is the primary reason why we talk of intermittent fasting. So the idea in intermittent fasting is not that you don't eat things, don't eat that, don't eat things. You can eat anything you want. The issue is, when do you eat it? So the ideal way to do it is to reduce your intake or not eat anything after, say, 5 or 6 in the evening. And till the next day morning, if you can give a gap of anywhere between 12 to 16 hours for the brain to relax and do its normal work, then you will see a great difference in your memory. In fact, your energy will go up. I can say this from personal experience. So I have not been eating dinner since the onset of COVID, which is the last 3 years now. And really, I actually have seen an increase in my energy rather than a decrease in my energy. So it is eminently possible to do. There are some people who follow the reverse method, particularly in Singapore and other countries where they don't eat breakfast. But for our kind of work, I think it is very difficult. Without breakfast, the energy is not there. And in the evening, we tend to eat whatever we get. So I don't recommend it very much. I would rather not eat much in the evening. And you can also eat a snack at 5 o'clock, which is protein-based. As Dr. Pranjali was saying, protein is very important when you do intermittent fasting. If you're only eating rice and dal, you have to eat more dal and less rice. Carbohydrates are not so important. Protein is important, fat is important. So ghee and protein, if you eat enough, you will not have a problem with energy. You can comfortably fast.
So, thank you, Dr. Shivram. There are no other questions in chat box. If anyone present over here has any question to Shivram, they can ask. If no, then thank you, Shivram, for such a nice and illustrative talk on.
Thank you, sir. Thank you, madam.
All medicine, true medicine are integrated. Here you are probably meaning integrative for yoga practices like fasting, Om chanting, meditation, so they are used in treating the disorders, certainly, plus maybe preventing disorders, and can be part of healthy lifestyle. So thank you very much.